name is Takoda Averett. I'm a P3 on the Pocatello campus, and today I'm going to be talking to you guys about why you should choose pharmacy. What do pharmacists do? Well, they are the medication experts. No one knows more about medications than pharmacists do. Pharmacists counsel patients on appropriate medication use. They educate other health professionals about medications. They can prescribe some medications and administer vaccinations. They can also compound medications into different dosage forms. If you have like a tablet and you need it in a liquid form or something like that, that's not readily available in the formulation your patient needs. We are the only healthcare professionals that do focus on the medications, so that makes us really important to the healthcare team. I wanted to go into pharmacy because I really enjoyed learning about the medications and different disease states, and it was kind of a way for me to get to be involved in all the little aspects, because there's a lot of different stuff you can do with pharmacy that a lot of people don't typically think about. Pharmacy is everywhere. There's a lot of things that, again, people don't really think about when they think about pharmacists. So there's a list here of some options that you can take that route if you're interested in pharmacy. There are pharmacists filling prescriptions in the clinic that oversees chronic disease states, and different teams in the hospital that are helping with your care. You can go into business for drug companies. There's a growing area in informatics, interpreting different healthcare professional practices, making different solutions that way. Just to highlight some of it, there's also academia you can get involved in. Working for insurance companies, just a few, just the tip of the iceberg for those. But it's really cool when you think about all the stuff that you can do, because again, typically you only think about the person who's filling your prescriptions behind the counter. Pharmacy is often one of the best jobs in healthcare. It has made it in the U.S. News and World Report in 2018. With growth potential, work-life balance, salary, that flexibility, it does rank in the 100 best jobs for people to have. It's a trusted profession. You become a vital part of the healthcare team, so working with teams and that type of stuff is a really good aspect. It's pretty interesting. Each day is different. You never know what you're gonna get. It's challenging. You have to go through a lot of problems and find solutions. You do have a lot of opportunity for that growth and the flexibility with working weekends, working nights, different places to work, and you do have a good earning potential. Some typical traits of pharmacists: you have to be good at science and math, you have to be good at solving problems and be dependable, well organized, detail oriented. You have to be able to communicate, because you have to work in those teams and you have to call providers and get stuff like that. And you do have to want to be able to help your community and improve other people's lives, because that is, at the end of the day, the main goal, is to make sure that the patients are being properly taken care of. So this is a question about how long it takes to be a pharmacist, and it can vary, obviously, depending on when you go to pharmacy school and how long it takes you to do your prerequisites and that type of stuff. But typically it is about 6 to 8 years. So it's shorter than, going to like med school, but it's still a long process because you have a lot of information that you need to digest and learn. This is a question about what degree pharmacists have, and pharmacists do have doctorate degrees, so that is a really cool thing. These are just some classes that you'll need to take to get into pharmacy school. You got to do chemistry. There's a lot of chemistry and knowing structures of drugs and how they interact with other drugs and how they interact in the body. Biology is definitely one that you have to take and understand. Math, there's lots of math. You do calculations for doses and stuff like that. And it's also good to take them whenever you can with AP or dual credit, and there is a pharmacy technician program. I actually did the technician program that they have here locally at my high school, and that's actually what got me interested in pharmacy. I got to tour the sites, a bunch of different pharmacies, and really fell in love with the field of pharmacy. And finally, we just have the all of our websites and our social media if you want to stay up to date on all the stuff we've got going on, and how to find us. But I really appreciate you guys. Thank you so much.